Pneumonia. What is pneumonia? It's an infection that happens in the lungs. It can occur in one or both lungs. Pneumonia can be triggered by viruses, bacteria, or fungi. The pneumonia that's caused by bacteria is the most common pneumonia among adults. Pneumonia inflames the air in the alveoli, which are the small air bags. Thus, the alveoli gets filled with fluids, which makes it hard to breathe.
There are many causes of pneumonia, but the main types are bacterial, viral, mycoplasma, and fungal pneumonia. Bacterial pneumonia is caused by bacteria and it usually infects those with compromised immunity. Viral pneumonia is caused by viruses, that is usually followed with bacterial pneumonia. Mycoplasma pneumonia or walking pneumonia, it's a type of atypical bacteria that causes a mild infection of the respiratory system. Fungal pneumonia is caused by breathing in tiny fungal spores. It's not a common cause of pneumonia for people with adequate immunity.
The symptoms and the signs of pneumonia start from the less severe to the most. This actually depends on the different types of germs and our age, and finally depend on how healthy we are. The less severe symptoms are just like those of flu or cold, but tend to stay for a longer time. So the signs and symptoms include chest pain when you breathe or cough, confusion or change in mental awareness in age 65 and older, cough which may produce phlegm, fatigue, fever, sweating and shaking chills, lower than normal body temperature, nausea, vomiting or diarrhea, shortness of breath. Infants and newborn sometimes don't show any of these signs, and they would only vomit, have a fever, experience coughing, and they would have difficulty eating and breathing, and they would always look tired. People who are experiencing difficulty breathing, chest pain, persistent fever, or persistent coughing, especially if you're coughing up pus, should directly see a doctor because they are at high risk, especially people who are adults older than age 65, children younger than age 2 with signs and symptoms, people with an underlying health condition or weakened immune system, people receiving chemotherapy or taking medication that suppress the immune system. Stages of pneumonia. Stage 1. Congestion in the first 24 hours. This stage is characterized histologically by vascular engorgement, intra-alveolar fluid, small number of neutrophils, often numerous bacteria, which end up making the lung heavy and hypothermic. Stage 2. Red hypotization or consolidation. Vascular congestion persistent with extravasation of red cells into alveolar spaces, along with increased number of neutrophils and fibrin. The filling of air spaces by the exudate leads to a growth appearance of solidification or consolidation of the alveolar parenchyma. Stage 3. Gray hypotization. Red cells disintegrate with persistence of the neutrophils and fibrin. The alveoli still appear consolidated, but grossly the color is paler and the cut surface is drier. Stage 4, last stage, resolution, complete recovery. The exudate is digested by enzymatic activity and cleared by macrophages or by cough mechanism.
Even in 1892, bloodletting was still a thing to treat pneumonia, but only in a minor amount of cases and very late in treatment. In the 1940s, penicillin begins to be used to treat pneumonia. However, improper usage of antibiotics such as penicillin led to antibiotic-resistant pneumonia strains. In 1977, pneumococcal polysaccharide vaccine is introduced to protect against bacterial pneumonia, but could only protect against a limited number of strains. In 2000, pneumococcal conjugate vaccine is introduced and could protect against a larger number of bacterial pneumonia strains. Today, only the strongest antibiotics work to treat the majority of pneumonia-causing bacteria, as they are resistant to other minor antibiotics. Minor community-acquired pneumonia can be treated at home with antibiotics, plenty of water, and rest. Cough medicine, fever reducers, and pain relievers may be prescribed to deal with the side effects of pneumonia, if needed. Any antibiotics prescribed will depend on what type of pneumonia the patient has acquired. If the pneumonia is viral in origin, the body will have to fight it off itself. On the other hand, major cases of pneumonia or cases of pneumonia in the elderly or the very young will need more care. Patients will most likely be hospitalized if needed. In the most serious cases of pneumonia, breathing may become difficult and require assistance to a ventilator in the ICU.
Based on my personal views on pneumonia, I think that young toddlers and elderly are to pay more mind into the disease and really take care of themselves whenever they are diagnosed and seek medical attention whenever it becomes severe, as 30% of total human population that are diagnosed with pneumonia actually die from the disease, and this also causes other viruses and bacteria to be easily transmitted into the victims.